doubles and coffee. Some messages transcend politics. In this pandemic, the PNM, the incompetence, has known no bounds. Last night, Gopeesingh gave an analysis of the report that has been handed in and laid in Parliament, 109 pages. Even though they weren't given in-depth powers to subpoena documents and witnesses, even though the Prime Minister gave them only 7 days and then it was extended for another 3 weeks, so 1 month. It's a scathing report which shows that people could have been saved, that lives could have been saved. It's scathing on the PNM's mismanagement of the COVID-19 pandemic. No politics. Stop the politics. This is life and death. This is health. This is expert. This is knowledge. This is science. Listen to Dr. Gopeesingh, the scientist. I make way for him this morning. Doubles and coffee, Gopeesingh. Share this. Share this. Share this. You must hear this. God bless.
Thank you very much, Mohani. Appreciated. Well, you make me feel relatively old now. Senior. Honorable political leader, leader of the opposition, and our distinguished former Prime Minister, Mrs. Kamala Persad-Bissessar, platform colleagues here tonight. Good evening, everyone. I will tonight discuss the findings of the report of the committee appointed by Dr. Keith Rowley to investigate the factors contributing to the clinical outcomes of COVID-19 patients in Trinidad and Tobago. That report was laid in the Parliament last Friday, the 18th of February. In fact, Mrs. Kamala Persad-Bissessar specifically called for a commission of inquiry into the overall management of the COVID-19 pandemic. And I called for a confidential inquiry into every single COVID-19 death for the last 8 months. So the very fact that this report was commissioned is thanks to the constant and undoubted calls and vigilance of our opposition leader and the United National Congress on behalf of a battered, weary, and oppressed population. Further, we had stated that 1 week could never possibly be enough time for that committee to review this COVID-19 pandemic. They got the fright, and they said that they decided to ask for another 3 weeks, which was given to them. So 4 weeks to conduct their investigation. But in the report, which I spoke about yesterday as well, there are no surprises in their findings, absolutely none, because we have been saying that every day for the last 6 months on the issues which they noted. Every single fallacy, shortcoming, and problem of this committee that this committee has identified, we have been saying that all along. And even patients and doctors and nurses and the families of COVID-19 victims have also been saying that all along. So there are no surprises to the information that has been provided by the committee in this report. Let us look at the analysis of the report's findings. Every single one of the report's findings, we had alerted the population to it. Let me dissect some of the key issues. And here are some of the committee's key findings. First, staff shortages. Staff shortages, as said, were common from the levels of executive management to doctors and nurses to orderlies and patient escorts. They continue to say in the report, some doctors had to do non-medical jobs like lifting and moving patients, pulling up patients in bed, and processing nasal swabs. Continue. Nurses in some instances also had to carry out duties outside of their regular function. We have been saying that from 18 months ago. From early in this pandemic, there had been a shortage of both senior, experienced ones, and other nursing personnel and doctors. The Nursing Association have repeatedly warned this governmental Minister Diyal Singh, and we in the UNC continuously warn them as well of medical and nursing personnel shortages very early, but they didn't take us on. The committee report went on to say doctors and nurses complained of overwork almost to the point of exhaustion. Concluding that the workload was severe, the committee said it must take a toll mentally, physically, and psychologically. This is what the report is stating. They go on to state that privacy and security were also areas of concern raised by the committee. At some sites, listen to this, 3 to 4 young doctors, male and female, had to sleep on mattresses on the floor in the same room. Imagine in this 21st century, in a developed country, this is what was happening under Dayal Singh's watch. Some doctors complained that the door to their room could not be locked. The committee said this was particularly worrisome given the current state of crime in the country. Is not Dr. Gopeesingh or the United National Congress saying that. This is the committee that is saying that. They go on to say nurses complained of having to work long hours in personal protective equipment. We said from the ab initio, from the beginning, that they did not provide enough personal protective equipment for the medical and frontline staff. And this report has showed nurses complaining of having to work long hours in personal protective equipment, often without a break to drink water or go to the washroom. How callous, inconsiderate. They also reported that they had to lift and turn patients because of a shortage of attendants and orderlies. Imagine a slim, slender nurse who is a nurse by profession have to at sometimes lift patients who are lying on their back and move them to the prone position or semi-prone position, particularly the obese ones whose distended abdomen push the diaphragm up, restrict the lung volume and the lung capacity, and prevents them from breathing. So the nurses had to do that because there are no orderlies in the system. And this is what Dayal Singh and Parasram and Trotman and Marian Abdul Richards were 2 years coming every day and talking a bunch of foolishness, and they don't know this is going on in the hospital. Where are the hospital managers? Where are the CEOs? Where are the medical directors? Where is Dayal Singh? This is a man who said that his responsibility stops at the door of the hospital. That man should have been fired from the time he made that statement. But Rowley wouldn't do that. The committee report noted that obese patients in particular were difficult to move. Many patients died from respiratory obstruction resulting from an inability to turn patients in a prone or semi-prone position. The committee said there were frequent complaints about very short locum contracts of 1 month to 3 months duration. You remember we were speaking about that for months and months, that they're not giving the doctors and the nurses any contracts. The committee said these short contracts create great uncertainty and depress the morale of young doctors who are exposing themselves to great risk. They recommended that the shortest contract be for a period of 1 year. Imagine you're taking a committee to tell you that you should be giving contract to the young doctors and the nurses. They were asking that from the beginning. And you know why they decided to do that? They want to hold them and give them no contract, hold them under threat, so that if they make any statement, they will send them off and dismiss them. In fact, they have moved 18 senior doctors as a result of that. The committee was told that in many instances, there was 1 ICU nurse nursing 6 ICU ventilated patients. Reports were also received about 1 registered nurse on the ward nursing 20 to 30 patients. This is shameful and disgraceful in the developed country. 1 nurse to 6 ICU patients, when the gold standard worldwide is 1 nurse to 1 ICU patient. And 1 nurse has to monitor 30 patients on a ward. How terrible that is. How can 1 nurse, no matter how competent she is, could manage 30 patients? You don't understand that patients will die as a result of that? It's not a fault of the nurse. It's a fault of Dayal Singh and his team. The report stated the implementation of the policies during the pandemic was hampered by unpredictable staff shortages and staff burnout. Staff burnout because you don't have enough staff. Almost every single doctor we met, the report goes on to say, complained of overwork, almost to the point of exhaustion. Some of these doctors also had to do non-medical jobs, example, lift and move patients. The doctors had to do it as well. And you know how sometimes small these doctors are. They're very, very tiny. Some of them are 23 and 24 years old, and they're slim built. How can they move these patients? They pull up the patients at bed and process nasal swabs. The report stated some staff complained about problems getting meals. I can tell you that. I was inside there in August of 2020. And meals, breakfast was coming 11 o'clock in the morning with a cup of coffee and a half of a sandwich. And your lunch coming 4 o'clock in the evening. And that continued right through. So the committee saw this. And they said the nurses were complaining of getting meals, especially after long hours in the hot zone. Some nurses spoke of the psychological pressure they felt when they were confronted with many deaths in a day. You can imagine a nurse working and seeing, and they can't help these patients seeing so many people die. They also spoke of the extreme mental stress they face when one of their colleagues died from COVID, stated the report. Yeah. I come to the drug tocilizumab. The committee reported on it. I have been talking about tocilizumab, a monoclonal antibody, an immunosuppressive drug that they should have bought from months and months ago, which was approved by WHO and approved by the Federal Drug Agency in the United States and in Europe. This is an approved drug for helping to save lives. That was conspicuous by its shortage. Experienced ICU consultants said that they only had about 20% of the required amount of tocilizumab. Pharmacists also agreed that the drug was in short supply. Why, Minister Dayal Singh? Why, Dr. Parasram? You admitted I think 2 nights ago on television, the cost of this drug is $8,000, and you said it was very expensive. Is $8,000 too much to save somebody's life? 1,000 patients with $8 million in tocilizumab drug could have been saved. $24 million could have saved 3,000 lives. Rowley, that is criminal. Parasram, that is criminal. Dayal Singh, that is criminal. Why didn't you buy the drugs to save these patients' lives? And there were also reports about shortage of other drugs, midazolam, methylprednisolone, to prevent the bronchial tree from becoming blocked up with secretions, and propofol to help the patients in ICU who are sedated. You continue a drip of propofol, which the anesthetists use to keep them relatively sedated. So all these drugs were missing. Dexamethasone was used in instances where methylprednisolone was indicated. And in addition, the committee said there was a shortage of basic items at the hospital, shortage of basic items, and also the drug that is used when persons are at a critical stage, which is tocilizumab. The key aspect of the report is the recommendation that the anti-inflammatory drug, tocilizumab, which is given at an advanced stage of COVID-19, should be purchased more, as it was conspicuous by its shortage. Yeah. Well, Dr. Parasram, doctorate, honorary doctorate, presiding over the death of 3,500 patients. You get an honorary doctorate for that. It is not a question on your knowledge and so on, but you presided over it. Dr. Trotman, you presided over it. Mariam Abdul-Richards, Dayal Singh, Rowley, the CEOs, the managers, the regional health authority boards, all of them should be fired immediately. And the committee went on to say, though tocilizumab is an expensive drug, there is a cost benefit to be realized from its use. We recommend that the policy regarding tocilizumab use be reviewed, the report stated. And then they spoke about the high rates of NCDs among the patients who died. That's a non-communicable disease of diabetes, hypertension, immunosuppressed patients, asthma, and so on, and cancer. Who died or who were hospitalized for COVID-19 were notable. It doesn't take anybody to tell us, the committee tell us that. We know when Mrs. Kamla Persad-Bissessar was Prime Minister of Trinidad and Tobago in 2012, we ensured that the 105 health centers, most of them were open up to 9 p.m. and on weekends and public holidays. As soon as Rowley and they came into government 6 years ago, they closed down most of these health centers And they reduced the time from 9 o'clock back to 3 o'clock in the afternoon. So when patients could have got their diabetes and hypertension controlled, they went nothing. And during this pandemic, people who were diabetic and hypertension could not get any medication. They could not be seen. So therefore, when they got COVID, they were a walking disaster. That is what this government was doing. This is what Rowley and Gopeesingh and his people were doing to the people of this country. The committee went on to say the crucial issue of ICU deaths. There is need for a national policy on intensive care unit admissions for COVID-19 patients of different ages and to have special ICU beds for elderly patients. The committee showed where patients 80 years and above were being deprived at times from an ICU beds. Was there triaging done? Was there Russian roulette as to see who would be put in the ICU beds? A national disaster and a national disgrace. The committee said on a national policy regarding ICU admissions and care of the elderly, the team noted that 15.2% of pediatric admissions were to ICU compared with 1.2% of persons over 80 years of age. And so many of patients over 80 years of age died. Were they deprived of ICU support? The report stated this was remarkable given the high death rate amongst the elderly. It was also noted that there were special pediatric ICU beds, whereas there were no such facility for the elderly. They're allowing the elderly to die. Was there a decision on that? By whom? Are you God? Not to put the 80 years and over patient in the ICU? In addition, the demand for pediatric ICU beds was in absolute terms much smaller than for adult ICU beds. In fact, the committee found that seniors 80 years and over had difficulty in getting the beds. And was there, as I said, was there triaging and leaving the 80 years to suffer by themselves and die. The another committee statement, we did not find any mention of a national policy regarding admissions to ICU for persons of different ages and recommend that such a policy needs to be articulated. Imagine 2 years into this pandemic and you don't have a policy for ICU admission. How disgraceful that is. Yet still Minister Young on Friday, I saw him looking at the television from my office, making a big thing that the Trinidad management of the ICU met WHO and international best practice standards. Is that international best practice standards? Is that so? You should be ashamed, Minister Young. I would consider this a gigantic fraudulent statement with hypocrisy and blatant lies and deceit. How can you go into Parliament and say that this was happening? I had long pointed out, ladies and gentlemen, that the health authorities and the Gopeesingh were hiding the ICU and HDU mortality statistics. The country would have heard me asking for that many times because they had turned the hospitals of the nation into killing fields. I asked this over and over more than 10 times in the last 6 months publicly, and the report confirms what I've been asking. Imagine the people appointed by the Prime Minister himself, that is the committee, were denied these statistics according to their report. Deliberate hiding of the information. Hiding the information. You see why Mrs. Prasad Bissessa called this a puppy show? This team had no legal remit, so they had to take whatever the same people accused of criminal negligence gave them. In fact, as I remember, the team had asked for 90 case notes. They got 25 case notes. 25 case notes. They were only able to interview 25 people across the 5 RHs. So any work could be done in 4 weeks. And this is why Mrs. Kamla Prasad Bissessa, as leader of the opposition, has been calling for this commission of inquiry, knowing fully well that 1 week, nor 4 weeks, or 2 months could do the work that is required to be done to unearth the difficulties that we experience. And one more point, the committee said there was need for improved communication by regional health authorities with patients' relatives. They said that frontline health workers felt abandoned by RHA leaderships. Among the findings were that Couva Hospital, Port of Spain General Hospital, and Augustus Lung Hospital had the most COVID deaths. And that is not surprising. Davlin Thomas chased out 18 senior experienced doctors And that is when the deaths began to rise. This is his doing. He removed intensivists, pulmonologists, anesthetists, cardiologists, nephrologists, emergency specialists. So are we surprised that patients began to die when 18 of the senior doctors were moved out by Davlin Thomas? And he is the boss because he is the Elsing right-hand man in his constituency, and he is Prime Minister Rowley, go for boy. And he could do anything, but they have caused the deaths of 3,500 people in this country. On communications with patients, the team stated anecdotal reports suggested that in the past, there has been severe dislocation between families and their loved ones admitted to hospital. This is what the team stated, that views of relatives of COVID-19 patients need further investigation. We could not assess their views due to the time constraints of this rapid assessment. We noted that relatives had no or limited access to patients during admission. We recommend a formal survey of the views of relatives of patients who were cared for in the parallel health system. Ladies and gentlemen, this is a very damning report. Even though I pointed out all these fatal shortcomings for the past year, it still horrifies me to see this in print. Imagine generations to come will read of this legacy of death and destruction of the COVID hospitals killing fields as the hallmark of the Rowley government's COVID-19 pandemic policies and management. The lives of 3,500 citizens have been lost and counting. So many families torn apart, so many heartaches and devastation, all because of the incompetence and inexperience, the arrogance, the cluelessness, the criminal negligence of this Rowley government, and especially the health minister and senior health managers. This report is a serious indictment on the Rowley government because all these issues, all these problems could have been prevented or halted midway if only Rowley and his team of incompetence had listened to Mrs. Kamla Persad-Bissessar, listened to us, the Opposition United National Congress recommendations, and taken urgent action to remedy these deadly ills. Everything the report notes, the population saw unfolding before our own eyes. Nothing here is a secret. So why didn't Rowley take action to prevent more deaths? Why did it have to come to this, where he had to bend to the unending pressure of the opposition leader, myself and her team, only to get 105 pages confirming what we have been telling him all along? No country, no democracy, no citizen should have to endure these deadly mishaps and mismanagement. But not this time. Ladies and gentlemen, we know what the PNM gives. We have been around long enough. We know the PNM style of mama guy, papi show, trickery, lies, deceit, and incompetence. But not this time. The country cannot let them get away with this serious criminal negligence again. There must be urgent action on this report. And I said yesterday, and I repeat today, this report must be forwarded to the police commissioner and director of public prosecutions for an in-depth investigation into criminal negligence and misconduct in public officer by all senior public officials who were involved in this. And I echo the sentiments of the Honorable Prime Minister, Leader of the Opposition. She is going to be Prime Minister again, so it's all right, I am premature. For a commission of inquiry into the Rowley government's mismanagement of the COVID-19 pandemic. Now the Simongal Committee did make another very important point in this report. Hear what they said. However, the committee said the time was too brief to allow a thorough assessment of COVID-19 clinical outcomes. And this alone is evidence that the opposition leaders' call for a commission of inquiry into Rowley government mismanagement of the COVID-19 pandemic must be held with urgency. That is the logical follow-up to this report. If the government is serious about taking action, because this would allow enough time, resources, and most importantly, a legal remit for a proper inquiry to be done. The blatant criminal negligence and misconduct in public office must be prosecuted legally. This has been a monumental disaster and must be the subject of an official report. The near 3,600 patients who sadly lost their lives due to the incompetence and deadly criminal negligence of Rowley's appointees must not have died in vain. They and their families deserve urgent justice. Trinidad and Tobago deserve answers and actions. And as I close, ladies and gentlemen, The entire management or mismanagement can be considered a state-sanctioned criminal act. Rowley and his government has deliberately and willfully violated citizens' constitutional rights to proper health care and protection of lives. It is criminal to allow the fostering of improper medical care, which has been going on for the last 2 years. And the report strongly points to this. They know people were dying helplessly. They lied to cover up. They continued to propagate it. And worse, they kept the same team of managers, CEOs, boards, minister, and his team to continue doing this. If Rowley continues to keep Diyal Singh and his team, he would be guilty of state-sanctioned murder against the citizens of this country. I say tonight, they should all be in jail. Thank you very much.